We've got Dr. Kevin Kavanagh, who is always spreading some, pretty discouraging news. But this morning, Dr. Kavanagh, who, by the way, is a retired physician and the president and founder of Health Watch USA, we've got good news from South Korea. Good morning, doctor.
Oh, good morning, Jack.
Yeah, spread a little sunshine.
Yeah, well, that's correct. As you know, the rates are kind of leveling off right now as we're reopening, and that's entirely expected. But the good news is coming out of South Korea. As you know, a lot of us have been a little concerned that immunity hasn't been proven yet. We'd expect it to occur, but theoretically, there still could be some doubts. And this was also fueled by the recent revelation that 13 of the sailors on the 1,000 sailors who were positive on the aircraft carrier reverted back to positive. In other words, they tested negative, then tested positive again. South Korea previously reported that, and currently they have 260 patients who have turned positive, and they cultured them. In other words, did a viral culture. That's a little bit harder than a bacterial culture, but they cultured them, and none of them grew a virus. So they may be shedding viral particles, in other words, little bits of RNA, what's picked up on the culture, but they're not shedding a live virus. And they feel that this supports the idea that if you get this virus, at least in the short term, you're going to be immune. Remember, with the coronavirus, immunity may wane after 1 to 2 years. Some people will say 3 years, but the normal cold type of a coronavirus, immunity lasts between 1 to 2 years. So that's good news, and that's encouraging news for a vaccine also, because if they can isolate the antibodies, which apparently they have, which causes this immunity, then that makes vaccine production more likely to work.
Interesting. And I also read here that the CDC is now stating that primary spread is person to person, which means getting the virus from surfaces less important. But that doesn't mean that we should stop, making every effort to clean those surfaces, right?
That's correct. That's like the old saying in medicine, you can't be a little bit pregnant. If you've if you've got a virus on the surface and you know that research has shown it can survive up to 3 days. I've read one place on glass, maybe 4 days, but 3 days is usually what's considered the rule of thumb, that if you have a virus there, it could potentially infect you. So you want to clean the surfaces. And the other thing that the CDC has on the website is that soap and water is primary. If you do not have soap and water, then go to the hand sanitizer type of cleaning, and 60% alcohol is best. And this is what you should be cleaning groceries. I know that we've had some questions on this, but if you've got groceries and you feel that you want to clean the boxes or clean the lettuce, whatever, soap and water is the best thing to use. It will mechanically rinse the virus off, and since the virus is a grease ball, the soap may actually kill it. Theoretically, it could actually kill it.
But you're saying put soap and water on lettuce? How could you possibly get that all rinsed off?
Well, you can. I think it's better than putting a disinfectant on your lettuce, because then you absolutely have to rinse it all off. And if you're worried about getting it rinsed off, you'll be in trouble. But you can soak lettuce in water to get that off. I would try to do that on fruit and everything. Lettuce, to me, is the biggest problem in cleaning. And as you know, if you had outbreaks previous to the coronavirus, that a lot of times was linked to lettuce, because that can carry E. coli. So yes, washing lettuce and making sure that it's clean is something that you really want to do. So it will take a while to do it, but that's what I would do personally. And actually, to be honest with you, I'm just not even eating lettuce. That to me is way down on the list of the things that you want to go after, because you can't cook it and it is very hard to clean, as you said.
And it tastes soapy, I've noticed.
Yeah, I was just
Sort
gonna
of a
say.
soapy taste.
It definitely tastes soapy, but
No more salads at Dr.
It'll
Kavanaugh's.
probably be a little bit safe.
Similar to washing your hands with soap and water.
Major hot spots in the state, mainly down in western Kentucky, Warren County, and counties to the west. What's going on down there?
Yes, I'm not sure, but it's definitely a hot spot. They have more cases per population than other areas, even than Louisville. In fact, Warren County has the second highest number of cases that you can have, or that we have. And so it's something that's very concerning. And so in those areas, you need to wear masks, and you definitely need to do social distancing because it can affect rural areas. And these cases are not just in nursing homes. They do have nursing home cases. There is one of the counties that has cases in nursing homes that look like it may represent a little bit of that percentage, but it's definitely in the general public, and you need to do social distancing down there. It's not just large metropolitan areas. It can hit the rural areas also, and that's the biggest take-home message from that.
But you know, the media gets hung up a lot of times on certain stories, and they're right now in the process of being kind of hooked on this President Trump taking the hydroxychloroquine to prevent infection. Nobody knows if it works, right?
That's correct. There are some trials that are studying it, and there's some anecdotal reports, but we've seen the same thing before with taking hydroxychloroquine when you have the virus, and multiple studies, along with some very large trials, although they weren't well controlled, they were still quite large, have indicated that this does not work when you have the infection, and it may cause harm. Usually when you take something prophylactically to prevent something from occurring, it also works when you get the infection. So I would be very hesitant on taking this, especially because it can cause some heart arrhythmias. I would be very hesitant on taking this with the idea that this may ward off an infection. And hydroxychloroquine is used for patients with rheumatoid arthritis and lupus, and they're now having trouble locating the drug, which may cause inadvertent harm with these patients, because these diseases, lupus and rheumatoid arthritis, can cause significant damage and harm to patients if they're not treated.
Now, I understand we also have in Kentucky our own supply of remdesivir. How did that happen? Where's it coming from?
Yes, well, that's coming from the federal government. They, as you know, have a pledge from the manufacturer for a lot of doses, and they have given that to Kentucky. Kentucky set up a protocol where hospitals can request it. They will have so much drug every few weeks or months, or whatever the supply line will be. It is in limited supply, but if you are severely sick and that drug doesn't run out, that's another good thing that we now have as a drug to treat patients. And this is another reason why keeping the case count so low is very important, because if you get the healthcare system overrun, a lot of our treatment options will not be available to everybody, and then the death rate will go up.
Dr. Kevin Kavanagh, we appreciate you very much, and we will get back with you on Friday.
All right, thank you now.
And also, Doctor wanted you folks to know there are now more tests than people who are getting the tests. And you can check the Kentucky Department of Health and Family Services website for testing locations. It's kycovid19.ky.gov, and then call for an appointment. That's kycovid, KYCOVID 1919.ky.gov.